It's my pleasure to welcome all of you today. I understand that a lot of you know each other because you've been working on childcare issues in this community for quite some time. So it's really a pleasure to get to bring you together to talk about the financial pieces that we have studied and learned about over the last year, all about how childcare is financed in Whatcom County. So I'm Heather Flaherty. I'm the Executive Director of the Chuckanut Health Foundation. I have with me today to help with the presentation Meredith Hayes, who was our project manager for this project and the master of details and spreadsheets and our interstitial wizard between all of the groups working on these visions. And then we also have David Webster here with us, who was a key contributor and offered so much wisdom and information. He's the Director of Early Learning and Family Services at the Opportunity Council. So we have a slide deck prepared. It's slightly different than the one we sent out to you. And there will actually be a few updates to the narrative report as well that we will send out to you. We've had a few local partners who have written in and updated some of their numbers. So we want to make sure you have the most updated. It won't materially change the percentages. I think the big takeaways will stay the same, but just FYI, it's always a work in progress, and there will be a newer draft coming to you. So I'll share my screen. Meredith, are you able to kind of keep your eye on the waiting room and admit people continually? Okay, great.
Absolutely.
And I'm going to share this slide deck, and I guess sometimes I jump right in. Are there any questions that people want to ask before we jump in? Feel free to share things in the chat too. Feel free to stop us and ask questions as we go. We really want this to be conversational. That's all of our presentation styles too. So, and if we had lots of time, I'd say let's all do introductions and say what the best thing is about our morning so far, but I'm afraid we don't have a lot of time to do that. So, okay. Here we go. I'm going to make you all big again too, so I can keep my eye on you. And I'm assuming you can see the slide deck. I'm seeing people's screens go off, so that means they're going into listening mode. And what I want to say to start is that this was over a year-long project, and it all started with a vision of, well, for Chuckanut anyway, it all starts with our vision of every child getting a healthy start. And though childcare is not the only thing that leads to a healthy start, it is quite a huge component and can be a generational trajectory changer for people who have access to childcare. And you all are aware of the many issues facing childcare in our community, and I know you're all working on different pieces of that. So I would be remiss to not say a huge thank you to our funders who co-sponsored this event or this report with us. The Mount Baker Foundation was a significant contributor. Debbie All was on the core team who planned and created the report. And the Whatcom Community Foundation and United Way of Whatcom County also have been key supporters from the very beginning. This is a long time coming. It's been talked about for a few years now, and from the very beginning, United Way and Whatcom Community Foundation leadership said, we're in, this is important, let's get some fiscal mapping done. Because we don't know what we need to do in terms of investing if we don't even have a picture of what the landscape looks like currently. I also want to say a very special thank you to the rest of the team. Whatcom County Council member Carol Frazee, who's on the call today. She was part of the core planning team. Bellingham City Council member Dan Hamill, David Webster, Christy Dominguez from Bellingham Public Schools, and Representative Sharon Shoemake was a key connector for us, and we'll tell you a little story later. And then our technical assistance from the Children's Funding Project. We would not have been able to complete this report without their help. There are two people in particular who were incredible. They've done this work across the nation, so they're really skilled at finding budgets and understanding and analyzing them. And those people are Kylie Wheeler and Kate Ritter. And if you ever have a chance to work with the Children's Funding Project, you absolutely should. It's pretty incredible, and they're a great resource that we love. So, and I also want to mention that this work lives within the landscape of community, which means we recognize that there are a lot of groups working on advancing visions around childcare. This report kind of lives in between the Generations Forward Policy Advocacy Funding Group, the Sustainable Financing Group. We hope it's helpful for the people in the Child Care Coalition and County Council and the task force working on big childcare transformational changes. And we also hope it's really helpful for, I guess I mentioned the task force, but I want to underline the Children and Family Wellbeing Task Force. So, okay.
Heather, can I jump in and do one more just bone of gratitude? Because I think would be remiss in not mentioning Willan's team, Willan and Willa Perry, who has been working in this for decades. A lot of this data also came from the data that they have been collecting forever as they do their work in coaching and working with programs and working with funders. So just want to shout that out as well.
Great, thank you. So we'll go over some of the highlights. The report that we shared has a lot more details. This is just the high level snapshot, and I think we'll be somewhat quick so we can move into questions and discussions. Quickly, the purpose of this project was we wanted to assist in childcare expansion planning, identify gaps in funding, and inform the creation of sustainable funding streams. Our goal was to start small with this and provide an example of what a fiscal map can do and what it looks like. And because fiscal mapping is really hard, and the more you add, the harder it can be. So that was why we picked these parameters to be very specific. So what were the parameters? We wanted to look at, specifically in Whatcom County, including Lummi Nation and Nooksack Tribe. We wanted to look at mapping birth to 5 childcare direct services and supports that are licensed. And we also added COVID relief for childcare because that was a big variable that came up for all of us and also shifted how we looked at this report. We looked at fiscal years 19, 20, and 21. You'll see a little graphic later about how we, the art and science of how we picked years. And we wanted to look at all levels of where those dollars are coming from into the community. So federal level, state level, local, we worked with Whatcom County and all of the cities. And then we asked about private philanthropic dollars as well. So there's a few pieces to this tool. One is the slides that were sent out already that have some graphic representations of the narrative report. They accompany that narrative report. And then we also have a data collection tool, and that will be housed at the Chuckanut Health Foundation. You're welcome to have access to it, but it is helpful to have somebody walk you through the tool because it looks like this. This is a screenshot of the spreadsheet. It's a robust spreadsheet. It looks at all of the different funding streams and the budgets, and they're coded in specific ways so that we can make meaning of the data. And this is where I segue to Meredith, who was, as I mentioned, our key detail keeper and the grit and tenacity that helped us finish this project. So here we go.
Wonderful. Thanks everybody for being here. Like Heather said, this has been sort of a long labor of mixed feelings. I can't even really say it's a labor of love. It's been, as you all know, especially there's so many of you who are deep in this work, childcare folks, that the complexity, and trying to really articulate it in a concise way has been a challenge, and especially given like the trickiness of the data and the trickiness of accessing it and aligning it and things like that. So like Heather said, please ask questions, ask for clarifications, and we'll sort of get through sort of understanding the context of how we can articulate this. So this really illustrates just one of the complexities, even like with the real basic understanding of what dates are we talking about. Fiscal years, really fiscal years, calendar years, this all really took some art as well as the science to figure out how to make it all make sense and aligned. So you'll see throughout there'll be a little bit of some subjective sort of guesstimates, some really objective measures, and we'll really try to articulate which are which. But this really goes to show, so this really illustrates, we had to take all these different fiscal years, calendar years, across all different levels and come up with 2 discrete years. So in this fiscal map, we have identified fiscal year 2019 and fiscal year 2020. And this illustrates how we sort of made those decisions. But we will talk about it in terms of those 2 fiscal years, one being sort of a pre-COVID, one being sort of a mix of COVID slash typical year. And then we have a separate call out for COVID specific dollars that are not integrated into some of these fiscal year conversations. So examples of data sources that are in here, we used websites that capture federal data. We used state budget documents. We hit up a lot of local contacts. Our state legislative offices were super helpful in helping us get DCYF data, school districts, contacts with philanthropy, and of course, again, the OC and the Child Care Aware Northwest. Integral data that they have been capturing and working to use effectively for years really came in handy and were some of our most impactful data sets. And by capturing a wide range of data sources, we were also able to articulate different funding streams within those different sources. We really, like Heather said, really focusing on funding birth to 5 licensed childcare. We're sure that there's other in the periphery that we maybe missed, but we really feel confident that we captured the major sources of funding that are driving the fiscal landscape for childcare. But I will notice, there'll be some in here that Department of Commerce is a good example. They have facilities grants and they have expansion grants. And so we were able to disaggregate those to be able to really understand the different objectives for each funding stream. All that to say, there were some significant challenges that I do think are worthy of noting, because I think they're indicative of a system that doesn't always integrate information across silos well. Challenges such as lack of efficient systems at the state level to track dollars across departments. We know that there's multiple departments that intersect with childcare at the state level. Commerce, DCYF, OSPI, there's a lot of different hands in childcare, and none of those systems work well financially or programmatically. So it made it really a challenge to get access to that data. Lack of available data around parent pay, about private parent pay, and also philanthropy. It's hard because there's not one big sort of data capture or dashboard to really help us articulate what dollars are coming in without going to specific programs and saying, who are your funders and how can we talk to them and things like that. So again, we really feel confident that we got the vast majority of the dollars that help tell the story of childcare in Whatcom County, but there were some challenges and limitations. And so when we get down to what did the fiscal map say, again, we looked at all those funding streams and we looked at them by a variety of factors: funding level, awardee, eligible services, age ranges, populations, funding stability, funding cycles, all those things. So again, some of those were more really clearly articulated, and some we sort of had to give our best estimation about where they're heading. But that's sort of what all those bars and charts in the actual data collection tool refer to, which then gets us to okay, let's look at the snapshot of overall funding for childcare in Whatcom County. Looking at not including private parent pay, which again is a much more estimated amount, and we'll get to that in a minute. This is sort of the investments from federal, state, local, public, and philanthropy major contributions. Fiscal year 2019, we're looking at a $17.8 million investment. Fiscal year 2020, it went up to $19.9 million, plus a COVID relief, specific COVID dollars that were right around $2 million. And the way that it breaks down, and we'll talk a little bit more about this specifically in the next coming slides, about 77% go towards program affordability, 17% for improving program quality, and then about 5% for increasing childcare supply specifically. Again, we know that there's a lot of overlap and a lot of integration of those categories, but that's sort of at the basic level what we're talking about. So really talking about an $18 to $19 million annual investment in childcare, not including what parents and caregivers are paying.
Meredith, I would just throw in that most of that estimated 5% for capacity expansion really came in late in our timing window.
Yep.
It was really a 2020 COVID response time frame. So.
And some of them are around specific projects that are happening. You know, when you get, I know Hart House, there's some other big ticket capital expenses, and so some of those end up being a pretty significant portion. Again, they're likely one-time investments or specific to a project, but they're in there, yes. And please, David, jump in as you go on. So these parameters are sort of the examples of what we measured: funding levels, programmatic outcomes, and eligible services. Again, I'm going to continue to point you to those documents. We'll go into these in a few minutes in our next slides, but I also want to just continually point you back to those documents that we sent out. There are more of these in there. These are the 3 that we picked to highlight today, but there's a lot of different ways to slice and dice the financial maps to articulate like specific questions that we might have about funding. But these are examples of things that have come up consistently that we knew that we wanted to dig into. Which gets us to the funding level of how, sorry, I'm letting people in. I should let Heather do that. So this is sort of the one really big and important slide that captures a lot of information. So in this slide, again, we look at what the investment is for FY19, FY20, a combined estimate. And then I also want to point out that this is the estimated cost of that parents and caregivers are paying. And David can speak to this. I ask you to jump in if I get this wrong. But what we really used is, again, those CREC and those OC, the Childcare Aware Northwest, what they know about program budgets, and looking at the proportionality of childcare programs to better understand what is coming from parents and caregivers and what is coming from other investments or subsidies. When you sort of look across the spectrum of programs, not including programs that are 0% subsidies and not including programs that are 100% subsidies, it really gives us this, it's about a 1-to-1 match. So we can estimate that in 2019, in that fiscal year, it's about a $17 million investment that parents and caregivers are making on top of our public investments. 2020, I think the proportions get a little off because of the cost of care and the COVID health and safety additional costs. But really, we're looking at about a 1-to-1 ratio. David, anything else you want to say about that you think is important to?
Just that it's a representative sample and we don't know how scientifically solid it is. There were a couple of Skagit programs we included because of the novelty of their programs, and Kenda and Abigail from the Center on Retention Expansion helped pull that together because we just happened to have fresh applications from a number of providers where we got their revenue sources and their annual budgets and stuff as a part of the grant applications they were making. So we took that cohort of providers, took out those that were pure subsidy, which aren't very many, or pure private pay, which are some, and then tried to figure out what is the public versus private balance. And so this is really a best guess based on limited data, but there was no other way we could figure out how to come up with that number that didn't require years of individual mining with individual providers. And it doesn't capture all the gray areas of, so how much sliding scale did that provider offer? Do they have uncollected fees from parents? And there's all that part of it too. But we just wanted to try to get some estimation of the total market pie.
Yeah. So looking at a total market pie of about $34 million a year in Whatcom County for the children who are currently in care. which then gets us into some of our programmatic outcomes. And I'm going to pass it over to Heather to jump in for these.
So as Meredith mentioned, we coded all of the funding streams on a variety of factors and wanted to look at the programmatic outcome. So what is the outcome of the dollars that are being invested? And you can see that 77% most fell into program affordability, which translated into subsidies for families and children. And Meredith and David, please correct me on any details I get wrong. 17% went toward improving program quality. Those were things like early achievers. And I think that goes towards things like training for staff and ensuring that credentials are up to date and all that. And 5% went toward increasing capacity and number of slots available. What's really key about that is that this is paired very well with the United Way demand assessment for childcare. And we have a big vision of expanding childcare slots in the community. We know there's a great need. And when you look at where the dollars are going, they're not primarily going right now to increasing the slots of childcare. They're going towards mostly making it affordable for children and families.
Heather, I would just add that one sort of involved conversation throughout this process was, how do you classify Head Start and ECAP on this pie chart? We fell on the side of it being affordability because it is primarily for very low income households to have access to early learning and care. Even though there are lots of performance standards and compliance issues that also affect quality of programming, we wanted to separate it from the clearly defined and discrete quality improvement work that EA has been doing.
Thank you. David, you can help on this next slide too. This is a slightly different take on how the dollars were invested, and it's looking at what were the eligible services that were purchased by those dollars. And primarily, the dollars went toward direct service provision, which also translates into funding that improves access to and affordability of childcare slots. And examples of those funds are Working Connections, Childcare, Head Start, and ECAP. And then about 13% went toward quality improvement. And that are those examples of those funding streams would be things like early achievers, and it's funding that improves the quality of childcare slots. And then we get into pretty small percentages going towards things like facility improvements, program stabilization, just keeping slots open, and comprehensive services, things like special education supports for children. Is there anything you'd add, David, about?
No, just that it's a real small sliver of the special education supports. There are much bigger dollars in early intervention and so on and so forth that are not captured here because it's a therapeutic model, not a care model per se. And as we come out of this focused time period, this is morphing even more. So in Willan's shop, for example, their new contract with DCOIF has their team, in addition to doing quality improvement, getting more involved in the business operations of childcare and trying to strengthen them. So it's going to be a good tag team with the Center for Retention and Expansion. So all this stuff is a freeze frame. This is a good example of that because as we go into 21, 22, these pie slices are going to shift a little bit more again.
Great, thank you. And then this next slide is about our community health outcomes. And this is my favorite slide. It is definitely a more subjective allocation or coding when you're looking at really what's the community health level outcome of the dollars we're investing. And this can be really aspirational, but this is a goal. We'd love to be able to see what is the return on our investment at the community health level. And there were three main ones that we looked at. You can see increasing school readiness, increasing economic stability via access to enabling access to the workforce for families, and disability support and mitigation. When we as a community work to align and identify and be transparent about our shared goals and outcomes and accountability, we can really start to measure this level of investment and impact. So what's interesting when you pair this with our current community health data about kindergarten readiness, for example, increasing school readiness, 16% of the investments we coded toward increasing school readiness. And you all probably have seen these snapshots of how our community's doing. On average, only about half of our children make it to kindergarten ready to learn. And when you look at that by race, it falls to sometimes as low as 12%, 10% for some of our Native American children, 26% for some of our Hispanic and Latinx children. And then when you look at it by income, you also can see that it's about 30% in 2019 who were considered kindergarten ready versus 62% out of the non-low income families, which still isn't great. Our goal is to get to 90% or better. And so when you start to be able to track where are investments going, what's the outcome, and how are our population level impacts changing, I think that's sort of the aspirational place we want to be as a community to make sure we're getting a high return on our public investments.
I think, Heather, I would throw in there as well, if you can go back to that slide, that these numbers are what they are based on the assessment of children in the fall of their kindergarten year. But we oftentimes don't have any barometer of the child's trajectory before that, especially in licensed care. Willan's team has worked with DCYF over the last couple of years to do a small scale pilot of taking Teaching Strategies Gold, that tool, into childcare settings, because Head Start ECAP already have it. And what they have found is that with the right support, those providers are able to come up with much better kindergarten readiness measures like Head Start and ECAP if we get that tool more widely used. So it's one of those things that we need to think about. I see Representative Shoemake's on the call. I think as we go to scale, looking at how do we, but rather than just giving them the test in kindergarten, how do we help providers specifically support the kind of things that Teaching Strategies Gold is measuring in the 4 or 5 years before they get to that threshold of the kindergarten door. So we know that those providers can do good work. Some of them are on this call and can come up with TSG outcomes that are just as good as Head Start and ECAP.
Thank you, David. I'll add to that. Clearly, childcare is not the only component of what drives kindergarten readiness. I would say that that's a proxy measure for a lot of things that go into child and family well-being from birth to 5 and how we're supporting families and children. Nonetheless, it is an interesting correlation to look at dollars invested and impacts and outcomes in the community.
I want to jump in and just give one quick, because I know a lot of you all are on that call. I know that creating an assessment, creating strategies to assess children around kindergarten readiness is one of our key priority, one of the strategies that arose from the Healthy Whatcom work. And so I also am just eager to jump in as a community around, as we look at this data and wanting to move the data, and also knowing that we have work to do around creating assessments that are more culturally relevant and appropriate. So just shout out to Healthy Whatcom for really elevating that and taking that on, and all of you in the rooms that made that happen.
So we went over what some of the measurements are and the local snapshot of 2019 and 2020 in Whatcom County. The narrative report goes into a lot more details, and we encourage you to look at that and call us with questions. And now we'd love to talk about what does that mean in our local context.
Yeah, so in our local concept, the landscape is ever changing. I mean, I think David hit on it when even in the time since 2020, there's a lot of new and exciting energy. There's a lot of different ideas. There's a lot of different funding mechanisms that are being considered, but wanting to sort of take all of this information and add on some other local contexts. So you all likely know that the child care demand study came out. So as we look forward of how to use this financial information, we are also kind of partnering that with the demand assessment to say, if we really are looking to meet the parent demand, we need to be adding about 5,800 more slots just birth to 5, knowing we need to do that with intention, being mindful of our provider sustainability, of meeting, again, the unique requirements or demands that specific families have. But that's how we're sort of couching this information. As we move forward to try to expand childcare, really being mindful of how do we do it. with intention with this target in mind. Which then also takes us to, speaking of Representative Shoemake, the great work that's happening on the state and Fair Starts for Kids. We'd be remiss in not mentioning that this big thing just happened at our state level, and we're so excited and also eager to see how that actually rolls out in terms of how it actually impacts the childcare landscape in Whatcom County. We know that there's at least three big components of that are really relevant to this, one being subsidies, one being increasing eligibility, increasing workforce supports, that those will be happening, and we will be figuring out what the impacts of that are on the financial landscape in Whatcom County and across the state. The other way that impacts is also it will change the amount paid for reimbursements. It will also change the number of children who are eligible. And even though that's sort of a moving target because of Fair Starts, the question of what is the delta, what is the difference between children and families that are subsidized and children from families that are asset constrained and limited income. So when we start talking about, like, we've got our families that are receiving subsidies, we also have our ALICE families that we know are finding it difficult to pay for childcare even though they're not eligible for subsidies. We worked with our brilliant partners, the Children's Fronting Project, and Kate Ritter, who is an early learning expert over there. And she was able to do some formula working to really identify that when we look at the 75th percentile of reimbursement, it still is leaving about a $17 million gap in what is eligible or what is available in subsidies and what ALICE families will need to be subsidized, or in order to make it affordable for all children in Whatcom County. That is the gap that we're really talking about, which seems like a really overwhelming number. I know for me, it's like, oh, well, how are we going to raise $17 million? And we're going to do it slowly but surely, taking in lots of different resources and being really resourceful and mindful and facing it head on. But that is really what we anticipate as, and again, that's an estimation. That's why we have like the dotted lines around it across some of these slides, but that's the estimation of what we're really talking about. If we're talking about affordable for all children in Whatcom County, or for all families in Whatcom County, that's what we anticipate or estimate that gap being. Which then gets us to taking all of this into account. If we were to say our FY19 budget, which is about, again, $35 million if you include the parent pay, and you were to say we need to increase capacity by 2.5 times in order to get to our slots that we need based on the parent and the child care demand study, we would end up looking at about an $88 million system. If we were just to blindly sort of take X times it by 2.55, it would get us to about an $88 million annual investment in childcare to get all families care who were demonstrated to have a demand. What it also would do is perpetuate the system that we're in, because we know that if we add $60 extra million or $50 extra million to this system, we're still not going to be in a better, more sustainable, more impactful system. So there's 3 other local investments that we need to call out at this time, and I think hopefully lots of you childcare folks will be nodding. But I think 3 really important things. There's a parent burden. When we start talking about ideally having our families paying no more than 7% of their household income on childcare, that's our goal. We know that parents and families who are making 400% of federal poverty level are not paying more than 7%. So why are our families who are making less income paying up to 39% of their household income on childcare? That's not equitable, nor is it sustainable. We also know that providers are carrying a huge burden, and we've known this, and we've been talking about this, I feel like, for years around the reason that we can't just expect providers to expand to meet this demand is because providers are and childcare operators are absorbing a huge amount of the cost of care, sliding scales, scholarships, other mechanisms that they're utilizing to make care affordable. Not even to mention just the difference in the cost of providing quality care from the cost of the reimbursement, either from the state or from a parent. And then thirdly, this workforce burden that we need to call out. Early childhood educators rank in the 3rd percentile of wages, and they're really incongruent with the level of skills and credentials that are needed in order to carry these jobs. And we are seeing that right now in the acute workforce shortage that I'm sure lots of you are dealing with on a daily basis, that the workforce is just really being asked to carry this burden and has been for a long time. So then we get into sort of the lessons from the fiscal map. And these are, again, there's a multitude of lessons, and I bet every one of you could read through the reports and come up with your own lessons, and I would love to hear them. But the ones that I think we really landed on were that this limited local investment leaves us with limited local control. As we noted in one of those first slides, only 5% of non-parent pay comes from local sources. The vast majority of our funds come from federal and state investments, which is great, but it does not allow us to have local control around how we want our childcare landscape to look. The local investments are being made on the backs of parents, providers, and the workforce. The second real big lesson that we landed on is that the siloed development of systems isn't really serving children well. So various systems at the state having various requirements, various fiscal reports, and having them not communicate. Even on the local level, things aren't really communicating and integrating well. Sorry, my daughter just walked in. And then thirdly, expansion without forging a new financial system will be expensive and ineffective. So we know that we have a huge demand that we need to increase childcare in order to meet. And we also know that expanding the current system would really negatively impact those who are already absorbing those burdens. Can we skip to the next slide? And then we'll go back to that one. So I want to spend a few minutes talking about the cost of an expanded system. So if we were to take the cost, if we were to forge a new public funding landscape in which the childcare options met the needs of children, in which sustainable childcare has a sustainable business model, and there were parity in wages for childcare workforce. I'm sorry, speaking of childcare without, or children, families without childcare, we need to create a new system. And I want to note on here that we need to create a system that doesn't include a parent burden, doesn't include a workforce burden, or doesn't include a provider subsidies. So this is sort of the system, this is the work that we are hoping to set out to do with this information, is figure out how do we fill these gaps in a way that we can expand in a healthy system. Which now let's go back to that previous slide, which leads us to our calls to action. And Heather, you can jump in here too. But really, this was a first step, or this was not the first step. This is like the 10,000th step in terms of looking and analyzing the problem. And there's a lot of new steps that I think we need to take in order to create this newly forged financial system for childcare in Whatcom County. And a few of them are on here. Continue to advocate. There are different pieces of information that we need to better understand. Facilities analysis to understand where the facilities are that we can expand, cost modeling to better understand what size childcare systems we need, or programs we need to invest in, but really wanting to highlight that our research and our continued research needs to be partnered with commitments of what we're going to do with these research pieces as we conduct them. Heather, do you want to jump in or add on?
I think you said it beautifully, and I also just want to note that I got the slides out of order, and Meredith, you still graciously lovely went through the presentation, so thank you. And I think just like takeaways, the calls to action that you come up with as you read through the report may be different, and we'd love to hear those. And some of the ones that Meredith mentioned, I think are really critical to how we advance these visions together. The expansion planning, of course, is key. That's sort of a like, yeah, we have some unmet demand here and it's getting worse, it looks like. Identifying those sustainable funding streams at a local level is another key call to action that we're talking about. And I know that Whatcom County Council is looking at different options, looking at using ARPA dollars for new facilities, and looking at other mechanisms to support things ongoing. Ensuring those investments that we do make are rooted in equity and accountability. I think the healthy Whatcom planning process is a really great place to look for how we're structuring those different strategies, and then aligning those systems everywhere we can so that the data does talk to each other and that we can make meaning out of it and understand, and we don't have to spend a year studying budgets to even just get to a number of what things are costing us. And as Meredith really beautifully noted, forging a totally new system is actually an opportunity here and something that we need to consider how we do, because right now the system doesn't seem to be working as well as it could be for providers, parents, families, children, and our workforce. So that,
Heather,
yes.
Sorry, I was just going to chime in that, especially as the guy who's usually seen as the glass half empty guy, I'm going to be the glass half full guy today. I think there are some local models that have sort of shown the way for us to still do better locally, but eventually at the state level as well. And that is where some of our school districts are reaching out and working with the child care providers in their district and figuring out ways to connect kids, transition them, follow them to see how they do kindergarten, third grade, and so forth. And I think that's a great model for all districts to look at if they're not already doing it, and for us as a community to think about. We've had for years districts who will track our Head Start kneecap kids into elementary and beyond to say, did the effect fade or did it hang on? We need to be doing that with our child care providers as well. I also think we need to realize that since this study began, complexity for providers has gone up. The pandemic has sort of discombobulated the market, and we now have not only caregivers who are reevaluating their life choices, but families who are. And I think while providers have been used to over decades of saying, well, I'm going to have a different child in the before school part of the slot than I will in the after school part of the slot, or whatever the case might be. Right now, they've got a marketplace where the families don't know how much childcare they're really going to want and use going forward, because they're re-examining their values in life as well. So just when we think we're starting to congeal here a little bit in understanding our marketplace, I think the first wave of COVID and now an impending second wave of COVID is going to make this even more complex, but we still have to stick to our mission here and try to figure it out.
Really great additions. Thank you, David. And that leaves us with opportunity for questions and conversations and reflections. So if there are any slides you want me to go back to, I'm happy to, but I'd love to stop sharing and get back to all the squares and have some conversation. Astrid, did you have something you wanted to, go for it?
Yeah, thank you. Thank you so much, Heather, Meredith, and the whole team for this project. It's so such valuable information and so important for our community discussions. I was wondering, just building on what David was just sharing about schools and school districts, and what are some thoughts about partnerships with schools to expand sort of access to childcare? We have schools in all of our districts, and I mean throughout our county, and know many of you here on the call today are related to schools. What are the conversations about using school buildings, school districts as sort of hubs for expanding access to childcare?
I could.
Oh, who to start talking? Go ahead.
Go for it, Willan. I've been talking too much.
So a couple of things that have been happening, and maybe I'll let Kay talk about what's happening at Mount Baker, but every year, starting with 2019, Child Care Aware Opportunity Council has sent a list of licensed child care providers in each of the school district boundary regions to each district, superintendent or their early learning designee, with some information and support about, what might be important to get a hold of the providers in your area, about how to some examples of partnership, those kinds of things have been going on for a couple of years. We'll be sending out the next lists probably mid-August. And also because we are talking about specific districts, Blaine School District has for probably the last, I would say 8 to 10 years, has been interacting with their licensed child care providers in a pretty deep way, doing site visits, including them in education work groups with their preschool staff and employees throughout each year. So those are just a couple of examples that are going on, but there's something happening right now that we're pretty excited about, and I'll let Kay talk about it if you don't mind, Kay.
Hi, everyone. I'm not really prepared to add too much at this time. I'm speaking from Mount Baker School District, and part of my job at the Mount Baker School District is to make those connections in a systematic way and support we have 2 licensed providers, one at-home provider and one outdoor program is licensed in our area. So a lot of my time and focus has been to connect with families. And David, when you mentioned talking about teaching strategies gold, part of my goal has been to help families understand also not to use the assessment, but to understand that child development, and how that will help them, because most of our families are using family, friends, and neighbors for childcare at this time. So we would love, love, love to expand childcare opportunities in our school district, which is the 2nd biggest geographical school district in the state. So we're so spread apart, it's difficult. But our focus has been working with those family, friends, and neighbors that are providing care, and especially the families, so that they understand what are we expecting, how to help their child be successful when they get to kindergarten. So I really appreciate all the work that's in this meeting, and everyone who's on the call. I appreciate you all and look forward, and I'm so happy. Even David's glass half full today.
I feel like that's such a big win. Astrid, the only thing I would add is that, and I know David wants to chime in, I think the various school districts have a varying level of readiness to partner. I think from my conversations with folks across the county, there is a lot of interest in learning more and knowing how those partnerships would look. But based on space or staff capacity, or providers that are in the area that it might negatively impact, I think those are some of the considerations. But I do think that there is a huge amount of potential in exploring that and exploring some readiness around the school districts to see how to use those as key resources.
I was just going to add that I think we've got some role model districts, sort of as Willan alluded to, and some new things happening. Bellingham schools are putting a child care early learning center into their new headquarters building in the Berkeley neighborhood. All 7 districts have either Head Start or ECAP classrooms in them as they try to bring the younger population in for transitioning in place to go to kindergarten. It usually comes down to a physical space limitation issue. They would do more if they had the room to do it. the Center for Retention and Expansion staff is working on an outreach plan because we also have to get better at marketing this profession to young people. So it's not just on Kim Doyle's shoulders to sell the career. And I think districts can be very involved in that as they do vocational exploration and other things in the school district. But they also have to be realistic, and we need to do a better job of telling them that it's a profession that is going to be honored enough to pay them the decent wage. So it's that vicious cycle that we've got to kind of solve. And I think we can, but the districts, I think, are willing and able. They've got some limitations, but I think I've often said in statewide meetings that I typically don't want the superintendents from other part of the states to talk to our superintendents, because we have the as Willan calls it, the unicorn effect, where we've got superintendents and administrations who get it and are willing to help out. And so often my colleagues battle the districts in the other parts of the state. So I think if it can be done anywhere, we can do it in Whatcom County.
Hi, this is Debbie All, and that's my phone talking. So from Mount Baker Foundation, and I just wanted to say that as one of the funders for this project, I'm really pleased with the results, because this was a massive, huge puzzle. And the one screenshot you set up, Heather, in terms of the data is like, as an early member of the core committee, I was thinking, how will this actually go through? So I'm very pleased with what you've come up with, and the pathway that we're all pursuing in terms of the combination of this with the child care demand study, which, as David said too, though, I think it's evolving as we come out of COVID, and there's just so much more to learn. I'm wondering if the next step forward, though, isn't the concept of and we've got so many pieces of it, but developing and documenting on paper a vision that for where childcare can be provided. And I love the idea of the school districts, and I love the idea of hubs. I've always thought of the elementary schools as being kind of a nice boundary of neighborhoods, especially when you start to look out at Mount Baker School District, which is half the county at least. But to look at the neighborhoods, to look at the elementary school boundaries, and to start to really try to put on paper the concept of the hubs that have been discussed, hubs that would also support the in-home licensed family care providers, because I think that will continue to be a strong part of our child care landscape, I think, especially with some of the infant care coming out of COVID. And so how do we do this? And so I'm wondering, in terms of moving that concept forward, the real documentation of what does this look like? And I know that we're also talking at the same time with the concept of sustainable funding and what that might look like in terms of local control and coming from Whatcom County. It seems like the piece is really there next, is what does that landscape, what was the best way to see that looking at, still at a high level. We won't have it all down, but everything with traffic patterns and everything else, in terms of where people are working and where these places should be located in that. I'd love to see that. And is that funding a consultant? I'm always looking as a funder, what's our possible roles in this? Is this, funding a consultant that can actually help to continue those conversations with the school districts, with all of the stakeholders here on this call, with the child care providers, with the CREC, if I get that right, David, yet, and how to really pull all that together. So I'm just wondering what this group thinks in terms of the next step forward.
Yeah, I think that's, well, and I'll stop and open it up for people, but I do think a facility scan is one of the things that we've elevated as a next step, and finding somebody who can look at, especially with, ideally, if the county council, with the brave leadership of Carol and Red, if we really are looking at facilities, to do a facility scan of, okay, what buildings are we talking about? We know the geographic distribution by school district that we think, at least in an estimation level, would be needed. But yeah, to really look at those facilities across the district, of saying, where do we physically want to put buildings, and do we have the resources to build or transform? But would love to hear other people's next steps on that very tangible question of who actually does that.
if I could jump in here, and I haven't met a lot of you. I've been in a lot of these different meetings, but I'm Kim Doyle and I teach at Whatcom Community College. I'm the coordinator of the ECE and education program there. And I always end up feeling really overwhelmed. And then there's things that are said and it's like, I want to say something. So this probably goes at least 3 or 4 comments back, but and I'm really good at stating the obvious. So you all know this. You know, it's one thing to do a facility scan and to identify those locations where we need more care. You know, we need to physically locate more child care so it's accessible and whatnot. But what I always, you know, I like to interject at this point is that at the same time, there's so many things that need to happen at the same time. You know, we have to be looking at ways, we have to be looking at professional development and compensation. We can build beautiful buildings all over our county, but we have to think about how we're going to staff them in ways that with individuals that are trained, that are well educated, that are committed, that will stay. You know, we have to look at why we're losing so much childcare right now. And if not the number one, then at least it's in the top 3 is compensation. And there's just this funny catch-22 between professional development and compensation. You know, DCYF has issued new educational requirements for childcare providers, and there's been tremendous resistance. You know, the question is why? Why should I go back to school? Why? I've been doing this for 20 years. Why? You know, so, you know, and so subsequently we're losing the good ones. We lose the good ones, right? And programs continue to be staffed with committed, knowledgeable individuals, but not in a real sustainable way that really reinforces quality and maintains it. So let's build buildings, let's work with schools, let's support everybody that's out there now offering childcare. And Debbie, thank you for reinforcing the importance of family childcare and the different locations and the different ways that childcare is offered. But we have to make it possible and desirable for individuals to seek out higher education, you know, and well-developed training systems. And we have to figure out ways to pay people more. And if we can't, these buildings are going to be further employed, you know, but we're going to be offering the same level of quality that exists at this time. So that's my spiel. Thanks for listening.
And I just want to, I mean, I think I want to reiterate this idea that, and I think Tara in the chat, you're nailing it, is we have to do all of these at the same time. We can't spend more time deciding which one comes first, because I think that is a really paralyzing state when we say, is it facilities or is it program quality or is it workforce development? Like, yes, it is all of those, and there's enough stakeholders around this table, and I appreciate those who are stepping up and saying, hey, we'll take on workforce development. Like, we will go and we will work in this direction. And okay, let's take on facilities and let's work on this direction. And then a crew that can say, hey, let's take this on. And then I think we need to make sure that we know that there is plenty of space and a really clear need for there to be multiple initiatives at the same time if we're gonna move all the levers at the same time to have it be successful. Because yes to everything that everyone just said, and it absolutely should be a yes and then how do we connect them while there are also people that are really moving that forward. So thanks to everyone.
If I could just add, thank you, Meredith. If I could just add that in terms of professional development opportunities, we're prepared to diversify. You know, it's not just a matter of coming to the college, right? I mean, we're trying to do that anyway. I mean, we know that we support, by and large, a working population. Early Achiever Scholarship, that's been a good model, and that's one of the things I do. I'm the point of contact for Early Achiever Scholarships at Whatcom Community Colleges, and I work with anywhere from 30 to 40 students a quarter on those scholarships, and it's great, you know. And to sustain that and to create other PD systems that again, I mean, we're willing to kind of go out and find the community. We can deliver training, right? We just need a system and support and funding, to do that.
I agree with both sides as well. And I think this is Debbie All again. I don't say sides. I agree with the concept that it is we need both. And so we do need to understand what will help us recruit and retain the childcare workforce, because I think they're exhausted and overburdened. And when you see that they're in the third percentile in terms of wages, that's pretty painful for the fact that this is where we think we need to invest, is in our children and in our families. And so I think that we need to explore and pilot what needs to happen in terms of the compensation and in terms of the professional development and just in terms of the training up front. I'm always amazed at what it takes to become a childcare worker for such poor wages. But then I think we also need that other side, which is what is the plan? What is the plan for where we will locate various types of childcare, and how will that be distributed in some very diverse and unique areas of our county? And that's what will also identify what types of workforce we need. So and different types of, I think, childcare providers need different types of support. The larger childcare providers provide health benefits. The in-home licensed care and the small centers, they don't have that. So what are the different kinds of funding we need? So I think we need the whole picture, and we need to keep working on the funding side sustainably for the retention of the childcare workforce and expansion. And as no doubt their requirements will continue to grow. So I think it's very much a blended plan we need to move forward with. And what I'm really pleased about is everybody here on the call, and the fact that Whatcom County is clearly working together on this issue. I just wanted to call that out.
Debbie and Kim, I also just want to acknowledge, as you are both speaking, there's so many head nods and just agreement with the things that you're saying. I want to honor the time. We're 4 minutes past the hour, and my glass half full for today is that Debbie, you talked about, what is the plan? And I think between all of us in this Zoom room, we have 95% of the pieces already done. We have Healthy Whatcom working on strategies for the community. We have the Child and Family Wellbeing Task Force. We have County Council looking at childcare. We have the City of Bellingham, I understand, looking at some workforce strategies and pilots. And I think it's a matter of kind of piecing all of those things together to have a clear picture of who's working on what pieces, what is CREC doing, what is Mount Baker doing. And I bet that we could talk for 3 more hours today about and learn new things even about what different projects we're working on. In terms of next steps from here, we will share the recording, we'll share an updated report. I hope it's really useful to you to just even have an understanding of what is the current funding landscape of childcare, because it does help us with those strategic conversations about, well, how do we fund what we need? And we're getting to those parts about, well, what do we really need? And Kate, I think your points are really clear that it's a complex landscape. And Meredith, you're saying it's yes, yes, yes. We need to do it all, and we need to all take the steps at the same time, and hopefully all in the same direction. And that's how you make really amazing transformational change as a community. So I know that we'll all see each other in different Zoom rooms. I'm not sure if we need to say, like, here's the next step, let's meet again. I think that the hard part from my perspective is, where is the anchor of who develops the plan? And so that's a question I'll just leave the group with, is, who is the developing the grand plan or keeping track of the details, and is that important? But other than that, yeah, I don't have any like inspirational closing today. David and Meredith, do you want to say any last words? And yes, I will share this set of slides with you all. I really appreciate all of your time. Meredith, it looks like you're poised to say something. David, you unmuted too. Take it away.
I don't have any final last words. I just do know that it's probably the United Way's commitment to create that plan. you know, we've been working with Healthy Whatcom to align the planning efforts. I know that Healthy Whatcom is deeply in, as it turns towards childcare in the fall. I think there'll be a lot of community strategies. And I think there are also, to your point, lots of things that we already have, and it's just a matter of writing it down. So I can commit to reconvening sort of this group to flesh that out and say, let's figure out what an actual like articulation of all of these pieces looks like. But want to just really so clearly say that United Way or me or Chuck and I, like at no point are we saying we will fix childcare and if we just need to put it on paper, but we really are asking each stakeholder to see, how can I move this forward? How can I not wait for the next piece of information to activate? But really, if each stakeholder, if each group, if each organization really like take, just feel the sense of ownership and activation. So those are my parting words, but we will reconvene.
David.
I would just say that, you know, as funders come forward to, you know, we know what has to be done, and there are many ways to peel this apple, but we've got to be willing to prove some incremental things work before we can go to the right sources to say, now we need to go to scale. So I know everyone is crazy busy, but as these opportunities come along to pilot some things, I'm hoping folks will step up because we're going to need to test some things out and then get ready to make our case. And I will say that at least in my 20-some years in Whatcom County, I think it's the first time that I've heard the words childcare cross the lips of the county executive. So I also want to make sure that we provide to our policymakers, both locally and at the state, the learnings that we do have, because I don't think much of this is unique to us. It's happening across the whole state, throughout the region. And so we can help our policymakers also make the change happen that they want to see.
If I may, I just wanted to say, sorry, I'm a little bit late. I had another meeting, but I'm very much committed to this task or need in our community. The second thing is my request is clarity. My request is clarity. There is not enough money. I just want to let you know that we are very lucky that that we have gotten this much money and the city has gotten money, but the demands on that are enormous. Like just child care problem, if we put all the money, is still not enough. So I think the best way to support this, the first step you have already taken, all the community is together. I'm not getting 20 different proposals from 20 different organizations. Give us this much, we'll do. Give us this much, we'll do. You guys do that. Come to us with one request to the council, and it should be very clear. This is what we need, and this is what we will accomplish. That's the only two words I want to say. I think the council is very sympathetic, but the funds are limited. Demands are very high on all, and all those things are as important. You know, we know all our community issues. So please drill it down. I think you will get the help you need. Thank you.
I think that is a very clear call to action. Thank you, Executive Sadhu, for being here today and for sharing that. And with that, I'd love to say thank you to all of you for your time. A special thank you to Representative Shoemake for helping us with this project and opening some doors for us at the state level too, to get some data that we really needed. So thank you. And thanks to all of you for the pieces that you are doing to make our community a better place for children and families. So we'll see you all very soon, I'm certain. And I'm going to press end. Thank you.